the concept of the operator syndrome frame, and it's a framework, not a specific medical diagnosis. So the framework includes traumatic brain injury, hormonal dysfunction, and I guess I'm talking about the pathologies, but we can flip this around and talk about them as domains to look at. So in special operators, we see high rate, and I'll just put it this way, for your average Navy SEAL, and when I say average, 90% who have more than a few years in, traumatic brain injury, low testosterone, other hormonal dysregulations. We have insomnia, just general sleep dysregulation, circadian disruption, sleep apnea. That's something we never used to look at. I think we're still not looking for that enough. Chronic pain, headaches, cognitive, impairments that go with everything, insomnia, hormonal dysfunction, TBI. And of course, anger, depression, anxiety, general anxiety. Yeah, there's some PTSD in there too. We've way overestimated PTSD. And I think that's part of the tragedy of modern mental health care. And we can come back around to that. Perceptual systems. So impairments in vision, hearing, balance. What else? Addiction. And then, so all of that is So part of what I'm saying here is physiology. I put a huge emphasis on physiology. And the mental health field puts psychological stuff forward with physiology in the background. My view is we need to reverse that foreground, background perspective. Physiology should be forward. And we're not doing that. And then, of course, we have the effects on all of the human physiological systems that then cascade into the social systems. So marriage, parenting, work, social, community. And then the existential issues that are very prevalent in high-risk professionals. So I just framed everything from the perspective of pathology. If we think of each of these as domains just to be curious about for each individual patient, that's what I think we should be doing in mental health care for everybody. Let's not start with the assumptions that if you're looking sad and you're tired and you're fatigued and you don't have much motivation and you don't feel like yourself, I don't think we should assume that that's major depressive disorder and immediately hand you a prescription for Prozac. We should take a step back and go, well, wait a minute. Let's check out some of these other things. How is your sleep? Are you suffering from chronic pain? What's going on if you're a man, what's going on with your testosterone? And, I've seen this over and over again. Guys who were diagnosed with depression, PTSD, prescribed psychiatric medications, given a therapist, or referred to a therapist. And then it turns out that's not their problem. They have low testosterone. When we treat the testosterone and it comes back up into a normal, healthy range, all that other stuff starts to clear out.
Yeah, that makes so much sense because I remember in my first platoon, a bunch of us had to get testosterone prescriptions out in town because and it wasn't like guys were running in the 800 range and wanted to just get huge.
Right.
I think we had 8 or 9 guys go get tested. I was one of them, and we were all like below 300 or right around 300.
Yeah,
right?
Like 80-year-old men.
Yeah, and this is like a bunch of pipe hitting alpha males that if you looked at them, you'd say, yeah, these guys are high T.
That's right.
Yeah, and then we had to hide it. You know what I mean? Like I remember going on deployment. I was putting testosterone vials in my blowout kit. You know what I mean? Like I had a second blowout kit, and it's like, how absurd is it that I have a prescription that's optimizing my hormones so I can be a better operator?
Yeah.
That I have to now smuggle on a deployment because if they find out, heaven forbid, they're going to say it's PEDs, which is, to me, it was completely absurd because I was thinking, if I were king for a day when I was an operator, I would have said, okay, every guy here is going to be on a complete program with a professional that this is what they do for a living. And because this is so critical for our job, we're going to get blood work, every 2-3 months, and you're going to make little tweaks. Hey man, maybe your testosterone dosage is a little high. We're going to bring it down, or hey, it didn't quite, and all the other things that you can, give with it. So every guy's on a specific program, but it's in a controlled and safe environment. Not, this guy's going to some guy in town that wants to give him way more than he needs. You know what I mean? And he's now running at 1,500 on his testosterone. Now he's mad at everyone, or whatever. You know what I mean? So it to me, it was such an obvious thing. Like, let's run this like a professional sports team. If like that was allowed within like, you know, WADA regular, you know what I mean? But it's like, hey, we're not competing in sports. So why are we acting like this is like, you got to like not talk about it?
I mean, and you know, SOCOM likes to say humans before hardware. Performance is everything. That's all we care about. You got to perform out in the, you know, on deployment. Why would we not take every possible opportunity to give you every edge? It's just astonishing.
Exactly. Well, especially when you look at from like a technological standpoint, it's like we exploit everything imaginable on the battlefield. You know, we got night vision goggles, we got ISR overhead, we got, you know, infrared lasers, all these things. We got comms where we can, you know, with multiple comms, you can run multiple channels. You
don't get to wear body armor because that's cheating.
Exactly. And then down at the operator level, the most important part, they were like, oh, you know, you better not get caught taking testosterone. It's like, it is literally the biggest disconnect, and I can't wrap my head around it. And I think they've made progress now, and maybe you have more visibility into. But I think, you know, NSW did some sweeping, like they said, we're going to start testing guys with like a WADA level test. Yeah, and it's like, who? I'm sorry, but what admiral that wants to get another star on his, you know, sleeve or shoulder? Like, what? Where is that coming from? That is the complete opposite of what they should be doing. Because now guys are going to freak out and they're going to get off of testosterone and they're going to go back to 280 and they're going to feel like shit. Yeah. And then all the effects that you know, are more versed on me are going to happen. Right?
And they're not going to perform.
Yeah.
As well as they otherwise.
You know, and so it's just, it blows me away. Yeah. And I feel like someone that needs to take over that's innovative and doesn't see it as, oh, that's like performance enhancing drugs. And it's just, but I don't know if that'll happen because, you know, it's like, you know, at a certain level of leadership, it seems like they all just turn into politicians. It almost becomes like prehistoric. It's like, oh no, that's, you know, they're like 40 years behind. And that's the scary thing about the psychedelics too. You know, Tony and I have been big proponents of that. We just had Brian Hubbard on, which is incredible. We see the obvious impact that can have, on everyone, but specifically the veteran community and first responder communities. But you know that they'll be 50 years behind on reacting to that. It's
kind of wild to think.
So guys are going to have to, you know, go down to Mexico. They're going to have to take leave and claim they're going on vacation with their wife, and really they're going to do Ibogaine in Mexico and getting reset and, you know, maybe saved. But they got to, again, it's kind of like the testosterone. They got to hide it, you know.